Hey guys, let's talk about reasonable and necessary services, which would be considered covered services under the Medicare Benefit Policy Manual. So this is going to apply to physical therapy services, occupational therapy services, and speech-language pathology. Looking at the screen behind me, this is taken from the CMS Chapter 15 Medicare Benefit Policy Manual. This is on the PDF, page 177. We scroll down under, let me see, this is section B, reasonable and necessary. First thing I need to point out is everybody talks about medical necessity. Is this medically necessary as a covered service? But very few people talk about, is it reasonable and necessary? You know, the definition of reasonable has to come from professional standards, standard of care. Now, that's not your standard of care. That's the profession's standard of care. Don't confuse those two definitions. But if we scroll down here to this bottom component, and guys, just for reference, all of this is the information that I dive deep into during my documentation modules that I teach as a standalone course separate from the 0 to paid group. Okay, so right here it says the amount, frequency, and duration of the services must be reasonable under the accepted standards of practice. The contractor, in this case the Medicare MAC, shall consult local professionals or the state or national therapy association in the development of any utilization guidelines. So this is the situation. Like, you might focus your time treating individuals of high medical complexity with lots of comorbidities and lots of complicating factors. But you're going to be compared to the average and looking at the average standard of care, what's normally expected. This is part of the criteria that's going to go into determining whether you're going to be selected for either a post-payment review or a TPE, which is a targeted probe and educate. I've gone through both, I've passed both, but I want to share those resources with you guys. Looking back into reasonable, I'm going to jump to another section in the same document. So this is on page 178. Quote, if an individual's expected rehabilitation potential is insignificant in relation to the extent and duration of therapy services required to achieve such potential, rehabilitative therapy is not reasonable and necessary. Now, yes, there's a whole section on maintenance therapy, and we'll talk about maintenance therapy during the documentation course, but I want you to see this. We know that Medicare doesn't require improvement on the patient's part. We know the GMO settlement, and we know that we can deliver services as a way to slow or stop the decline of a progressive condition, but these are still important components. Right? And when you're thinking about transitioning from rehabilitative therapy to maintenance therapy, you're thinking about covered versus non-covered, maintenance or rehab. These elements need to be in consideration, right? And just as an example, an eval or re-eval. Well, they always require the skills of a therapist. A non-therapist cannot do a therapist evaluation. Like, a non-PT can't do a physical therapy evaluation. So these are simple things that generally will always fall under covered services, especially when there's a referral in place from another medical professional. But the last screenshot that I want to cover in this video is this right here on page 178 again, where we scroll down and let's see here, this section right here. So, quote, rehabilitative therapy is not required to affect improvement or restoration of function when a patient suffers a transient or easily reversible loss or reduction of function, right? So what does that mean? Based on their example, temporary or generalized weakness, which may follow a brief period of bed rest following surgery. That could easily be expected to improve spontaneously as the patient gradually resumes normal activities. Therapy furnished in such situations is not considered reasonable and necessary for the treatment of the individual's illness or the injury, and the services are not covered. I think you can, based on published guidelines, go through and pick out for yourself what are other situations that, yes, a physical therapy evaluation would absolutely be a covered service. Like in that case, patients hospitalized, they're on bed rest for 7 days, they're just discharged to home. I believe an evaluation establishing treatment goals specific to the patient's condition, designing a plan of care. Those are all covered services, even in that condition, even if it's reasonable to expect the patient to get better on their own. What wouldn't be a covered service would be continuation of the delivery of those services. So maybe in that session, you instruct the patient on compensatory skills, or you train the family and caregivers on supplemental services. Maybe you select a device to augment function. And then potentially at periodic intervals, you come back to assess the patient's condition, assess their progress or decline, update the programming, teach new skills. That would still be covered services. But what you don't see in this list is the actual delivery of follow-up care. So in a case like that, you might be hired on a private pay basis to deliver the plan of care. Establishing the plan of care was paid for by Medicare. Delivering the sessions between the assessments might be self-pay. And then intermittent or at regular intervals, which could be 4 weeks, 6 weeks, 12 weeks, you then provide a covered service in the form of your clinical judgment. You update the progress, you change the goals, you determine, are they improving? Are they staying where they are? Are they declining? That would be a covered session. But for all of that, the point is it needs to be reasonable. It needs to be within the scope of your professional practice designation and within the accepted standards of care. So 5 days a week might be what you recommend, but that might be in excess of the standard of care. So we need policies to be established that help you make that clinical decision and help you determine this is self-pay, this is a covered benefit, and you give the patient the right to choose what they're going to do based on your recommendation. Guys, I hope that was helpful. I'll catch you on the next video.